Assalamu alaikum. Welcome to Pediatric Case Review. Today we will continue with systemic lupus erythematosus. We will discuss in this episode the epidemiology and the pathogenesis. Let's begin. Our case today, a 17-year-old female presents with fatigue, joint pain, and noticeably butterfly-shaped rash across her cheeks and nose. She has also reported occasional headaches and photosensitivity. Her family history showed that maternal aunt was diagnosed with systemic lupus at the age of 30, and their past medical history shows frequent episodes of skin rashes after sun exposure and a history of mild anemia during childhood. Regarding social history, she is active in outdoor sports, no smoking, no alcohol use. During physical examination, she appears tired but no acute distress. Skin showed malar rash with no discoid lesions. Musculoskeletal examination showed mild swelling and tenderness in wrists and knees. Neurological examination was normal. No signs of neuropsychiatric involvement. Laboratory tests showed the following: CBC, mild anemia, ANA positive, anti-double-stranded DNA positive, complement level, low levels of C3 and C4. So our assessment for this case: this is a patient with clinical presentation suggestive of systemic lupus erythematosus, considering symptoms, physical findings, and positive lab tests. The presence of family history, along with her ethnic background, points toward a genetic predisposition. Her frequent sun exposure and the resulting skin rashes indicate environmental factors like ultraviolet rays. These ultraviolet rays contributing to disease onset. The positive anti-nuclear antibody and anti-double-strand antibody, along with low complement levels, align with typical immunological findings of systemic lupus erythematosus. Question 1. What aspect of demographic profile aligns with reported epidemiologic trends of systemic lupus? A. The age. B. Involvement in sports. C. Female gender and African American ethnicity. D. History of mild anemia. The correct answer is C. So epidemiological data indicate a higher prevalence of systemic lupus among women, with an even greater risk in African American individuals compared to other ethnic groups, and this illustrating the significance of demographic characteristic in the epidemiology of systemic lupus erythematosus. Question number 2. Which aspect most strongly suggests a genetic contribution to systemic lupus? A. Positive ANA anti-double-stranded DNA. B. Her female gender. C. Frequent sun exposure. D. Family history of systemic lupus. The correct answer is D. So the presence of systemic lupus, particularly in close relative, strongly suggests a genetic component to the condition. This genetic component is complex and involves multiple genes. Family history of systemic lupus indicates that she may have inherited genes that increase her susceptibility to the disease. This genetic risk factor, also accompanied with demographic and the clinical profile, significantly suggests the presence of systemic lupus. Question number 3. Considering hormonal factors in etiology of systemic lupus, which aspect is relevant? A. Age. B. Gender. C. Involvement in sports. D. History of skin rashes. The correct answer for this question is B. Hormonal factors, particularly estrogen, play a critical role in the pathogenesis of systemic lupus. So systemic lupus is more common in women, potentially due to modulatory effects of estrogen on the immune system. So the increased frequency of systemic lupus among women has been particularly attributed to hormonal influences, suggesting a vital role of gender-related hormonal factors in the disease's development. Question number 4. Which lab findings are indicative of immune system abnormalities associated with systemic lupus? A. Positive ANA and anti-double-stranded DNA tests. B. Low complement levels. C. Both A and B. D. History of mild anemia. The correct answer is C. So the presence of positive ANA and anti-double-stranded DNA tests, along with low complement levels, are indicative of the immune abnormalities characteristic of systemic lupus. These lab findings suggest an overactive immune response with the production of autoantibodies and complement consumption. So these abnormalities are hallmarks of systemic lupus, reflecting the underlying dysregulation of the immune system. Question number 5. Which aspect suggests environmental factors contributing to systemic lupus? A. History of skin rashes after sun exposure. B. Positive family history of systemic lupus. C. Low complement levels. D. Joint pain. The correct answer is A. History of skin rashes following sun exposure points to environmental factors, particularly ultraviolet radiation, as contributors to systemic lupus erythematosus. Ultraviolet light is a known environmental trigger for systemic lupus, capable of exacerbating symptoms and potentially influencing disease onset. Skin reactions post-exposure to sunlight are consistent with photosensitivity commonly seen in systemic lupus. Question number 6. Which symptoms are indicative of the complex pathogenesis of systemic lupus? A. Joint pain and skin rash. B. Photosensitivity and fatigue. C. Headaches. D. Both A and B. The correct answer here is C. The combination of joint pain, skin rash, photosensitivity, and fatigue reflects the complex and multifactorial pathogenesis of systemic lupus. These symptoms are the result of combination of genetic predisposition, immune system abnormalities, hormonal influences, and environmental triggers. The diverse nature of these symptoms demonstrates the systemic impact of systemic lupus and its multifactorial etiology. Question number 7. What finding would be a concern for potential kidney involvement in systemic lupus? A. Positive ANA test. B. Low complement levels. C. History of mild anemia. D. Joint pain. The correct answer is B. Low complement levels are concerning for potential kidney involvement in systemic lupus. So, lupus nephritis, immune complex deposition, and complement activation in the kidney are common pathological mechanisms, and low complement levels could indicate complement consumption due to ongoing immune process in the kidney. Question number 8. If a patient with systemic lupus developed thrombocytopenia, which pathogenic factor of systemic lupus could be implicated? A. Hormonal imbalances. B. Cell surface antibodies. C. Environmental triggers. D. Genetic predisposition. The correct answer is B. Thrombocytopenia could be due to the presence of cell surface antibodies, a pathogenic factor in systemic lupus. These antibodies can target and damage various cell types, including platelets, leading to conditions like thrombocytopenia. And also, the presence of these antibodies can contribute to the disease's multi-system involvement, including hematological manifestation. Question number 9. In managing systemic lupus erythematosus, why would monitoring for antiphospholipid antibodies be important? So, why we monitor antiphospholipid antibodies? A. To assess kidney function. B. To check for risk of thrombosis. C. To evaluate skin lesions. D. To determine ultraviolet light sensitivity. The correct answer here is B. Monitoring for antiphospholipid antibodies is crucial to assess the risk of thrombosis. Antiphospholipid antibodies are associated with an increased risk of both arterial and venous thrombotic events associated with systemic lupus patients. Their presence can significantly influence the management strategy, emphasizing the need for potential anticoagulation therapy and close monitoring for signs of thrombosis. Question number 10. Considering the pathogenesis of skin lesions in systemic lupus, which factor is most likely contributes to butterfly-shaped rash and photosensitivity? A. Positive family history of systemic lupus. B. Joint pain and fatigue. C. History of skin rashes after sun exposure. D. Low complement levels. The correct answer is C. Developing skin rashes following sun exposure is highly indicative of pathogenesis of skin lesions in systemic lupus. Ultraviolet light from sun exposure can trigger or exacerbate skin manifestations in systemic lupus, including the characteristic manner or butterfly rash. Ultraviolet radiation is known to induce apoptosis in skin cells, leading to the release of nuclear material that may become autoantigenic. Additionally, it can alter cellular proteins in the skin, making them more immunogenic and triggering an immune response. Photosensitivity and the reaction to sun exposure align with this mechanism. So, where ultraviolet light acts as an environmental trigger, exacerbating the skin symptoms and illustrating a key aspect of the pathogenesis of skin lesions in systemic lupus erythematosus. Thank you for joining us. Stay tuned for more pediatric case reviews.